Today, I come to you all on Senate Bill 40, an important piece of legislation that is focused on removing barriers to necessary speech therapy for individuals who stutter. By doing so, we're going to require comprehensive insurance coverage, including state employee health plans, Medicaid, and private insurers to ensure that particularly children have the benefit or reap the benefits of speech therapy that would help them develop their speech so that they can be more productive members of society. What are the benefits for public health and community well-being here? For children who stutter in particular, they have more opportunities to build critical communication skills, improving educational and professional outcomes. Now, for me, this is deeply personal. I have, at an early point in my life, experienced stuttering that came out of nowhere. And by working diligently to overcome the issue of stuttering, I was happy that I'm able to overcome it. But as a father of 6 children, 2 of which who currently experience difficulty with speech, I know firsthand that my son, who is now a freshman in college, was able to overcome his speech issue as a child. He didn't speak until he was nearly 6 years old. And with the help of a speech therapist, I'm happy to report that right now he is doing quite well as a freshman in one of our flagship universities here in the state of Illinois. And so I know that this works, and we want to ensure that regardless of anybody's economic situation, that every child in Illinois has an opportunity to overcome the speech issue that they are faced with through no fault of their own, including stuttering.
I can't tell you the amount of support I have for Senator Preston's bill, because it's just hard for me to comprehend that we were in the same place over 20 years ago. I have a son who 20 years ago I detected that there was a speech issue. And I wanted to get him help. When I called my insurance company, they said, we will only cover speech problems if it's congenital or if there's been an injury. I tried to explain, babies can't speak. Babies can't talk. How do you know if it's congenital or not? Because they can't speak, and they don't speak really clearly until they're 3 to 4 years old. But when you can get that early intervention, you can help that child develop confidence. You know, a student, a young person in a classroom who has a speech problem, who stutters, they don't raise their hand to answer a question. They don't read aloud. They impede their educational development because of a language problem that clearly help could prevent. Unfortunately, fortunately, I had means to pay privately to help my son, who graduated last year with honors from a prestigious school, and he was able to get into that school. It's not an indication of their ability to comprehend, of their ability to learn, of their IQ. It's simply an issue that can be corrected. And for our insurance companies not to provide full and comprehensive coverage for speech therapy, regardless of the diagnosis, it's criminal.
Thanks for watching this video. Please like and subscribe to keep up to date with news from the caucus. For more information on what the senator is working on, please follow them on social media using the links in the description down below.